For over 20 years now, fathers-to-be and partners have been encouraged into the arena of their baby's birth. This has been a big step in a good direction, but if you're not confident about the role you're playing, your anxieties could be counterproductive in a space where relaxation is so very key. In the previous video, Really Useful Massage in Pregnancy, we looked at ways of bringing positive touch into your everyday life throughout pregnancy to relax and to connect with each other and with your growing baby. Not only looking ahead to a better birth experience, but also communicating and supporting each other through a time of change in a way that's beneficial to your relationship and your future relationship with your baby. We looked at simply getting comfortable and massaging each other and connecting, sometimes just being there and holding each other. In the third trimester, it's important to continue all of that, and we're now going to add some more specific techniques and positions appropriate for later pregnancy and for labour itself. What's ideal for helping your baby to get into the best possible position for birth, and also great for labour, is for the mother-to-be to have her shoulders in front of her hips and to be able to move her body. Good ones to try are leaning or sitting on a yoga ball, being on all fours, leaning over pillows over a bed or chair, standing supported by the wall or by you. Especially helpful for the mother-to-be is for her to be able to move her hips and her shoulders and to be upright so that your baby is not working against gravity to be born. And it's great for her to try out lots of different positions while you're practicing, because especially in early labour, she will want to be able to move and walk around. And as labour progresses, one position might be great for a while, and then she might get the urge to move into another, and then another. Massage in pregnancy can be comforting, connecting, wonderfully nurturing, can relieve muscle tension, and it's great preparation for being together in labour, and long beyond that. In labour, massage and touch are all of the above, and also offer a way of communicating your love, support, and reassurance, in a space where in-depth discussions are not the best way of communicating. It can help create and maintain a lovely, relaxed atmosphere, and that bubble of altered state which the mother-to-be needs to be in for labour to progress. Massage stimulates the release of endorphins, which are the body's natural pain-relieving opiates, and that powerful feel-good birth hormone, oxytocin, and reduces adrenaline. Massage can also be restorative in the space between contractions and relieving during contractions. We're going to look at two types of stroke. The first are soothing, which can be used at any time to comfort and calm, and in labour can be specifically useful between contractions to help the mother-to-be to recover and get some energy before the next one. The first we've called waterfall. Long, slow, continuous downward strokes, using one relaxed hand to stroke from the nape of her neck all the way down to the base of her spine. When one hand is finished, the next has already begun its journey. Keep your movements slow and soothing. Allow your hands to mould softly to the shape of the mother-to-be's body. Tune in with her breathing and keep your own out-breath long and slow as you massage down and down. The next soothing stroke we call hearts. Use both hands and start between her shoulder blades, then stroke up and out over her shoulders. Slowly stroke down the back until your hands meet, before sliding up and over the shoulders again. This movement traces a heart shape on her back, communicating love. If you notice her shoulders are tense and raised, gently encourage them down as you stroke over them. These are just 2 suggestions for soothing strokes. By practicing, you can explore and create your own. Ask for lots of feedback from the mother-to-be. What feels good? Anything she doesn't like? She needs to say and feel comfortable saying it. Remember the golden rules of massage. It should always be with permission, never be painful, and it should always feel good. The second type of stroke we're going to look at are ones that are firmer and great for releasing muscle tension at any time, and specifically in labour can be really relieving during contractions. In labour, they should be directed where contractions are felt, and you won't know where this is going to be until labour actually starts, so practice them all. They'll feel great anyway. Contractions are often felt most intensely around the sacrum, which is that flat bone at the base of the spine. Using plenty of pressure, massaging in a circular movement can be really helpful. Making a fist and kneading into the buttock muscles with the flat part or the heels of your hands can also be very relieving during a contraction. As it intensifies, your fists can be turned backwards and forwards whilst leaning in further to increase the relief. Use your body weight, not your arm strength. Lean into the massage. Save your strength. Contractions may be felt in the lower belly, in which case try starting with your hands together underneath and slide them gently but firmly apart as you breathe out. Slide your hands up and then in to meet at the centre of her tummy, and then slide gently down to begin again. During pregnancy, practice this very gently, and during labour you can apply more pressure as you slide your hands apart. If contractions are felt in the groin, then use the heels of your hands to sink into the top of her legs. Maintain pressure as you slide your hands down the legs, breathing out, and slide up gently as you both breathe in. Tuning in with each other's breathing is grounding for you both, and if you can keep your breathing relaxed and slow, then it will communicate this to her without you having to mention the word breathe. Let's see how the 2 types of technique can work together in labour. Firm strokes into where contractions are felt during the contraction. Soothing strokes between contractions for recovery. Firm strokes into where contractions are felt during the contraction. Soothing strokes between. Firm strokes into the contraction. Soothing strokes between, and so on. It's by practicing that you'll build up a language of touch that will be powerful beyond words in labour, so that at any point you feel that tension is rising, you can try touch as a way of showing that you are there, you're supportive, and you are staying calm and grounded yourself. If she's used to your loving and practiced touch, and she trusts you to stop if she gestures for you to do so, then you may be able to help her stay calm without breaking her focus. While you're practicing at home in the build-up to labour, you could speak while you're using the soothing techniques. I love you. You are amazing. We're one contraction closer to our baby being born. If you do this often enough, then before long these words and feelings will be communicated by your touch alone, without you having to speak. Feet and hands are usually accessible whatever's going on in labour, and massaging these can be a wonderful way of relaxing her whole body, reminding her that you are there for her. It's possible that at some point during labour, she may not want to be massaged or touched at all, particularly in transition where her cervix is almost fully dilated, and there will be a change of pace building up to stage 2, the actual birth. And this is absolutely fine. Don't take it personally. Stand back, be there, stay present, and stay calm. Be there. It's enough. Whilst the couples in this video have been clothed, in the privacy of your own home, skin-to-skin contact using massage oil is much more effective. I can't stress enough how important it is to practice. The more you practice and make positive touch a part of your lives, the more useful it is likely to be in labour. And even if you don't end up using it in labour, you've developed a tool for life. I hope you found this useful. If you've got any questions at all, please get in touch. Thank you.